Hi everyone, welcome to my channel. I just put our daughter Isla down for a nap, so I'm going to try and do a little twin pregnancy update now that I have a little bit of downtime. She's not sleeping yet, so I might have to run and make sure she goes down because she seems to be fighting it a little bit today. But anyway, yeah, so today I'm going to go over how we found out we were pregnant and how we found out it was twins, and just a little bit about how I've been feeling from the beginning until now. We are at week 26. So we have a daughter who is going to be 2 in March, for those of you that don't know, and around the time she was about 16 months old, we started to get baby fever. We knew we wanted more than one child, so naturally we were gonna start trying soon, and I didn't want to put too much pressure on trying, but I was excited to because with our daughter's pregnancy we were actually not trying yet. We were sort of actually trying not to get pregnant until a few months later because we had a wedding that we had to do some traveling for. So that came as a little bit of a surprise. But because I knew I could get pregnant, I didn't want to put too much stress on it, yet I was excited to start trying. So sure enough, I went out and grabbed a ovulation kit just because I wanted to see how that all worked, and I was tracking my periods on one of those ovulation apps. So come the summer, it was July, August, I'm one of those people that, believe it or not, can feel my ovulation cramps about 2 weeks after every period. So I didn't really need the ovulation kit, but I was excited to use it anyway. And so I think we had got a positive test, but it was very faint, on about August 8th. And then August 9th, I had major cramping in my left ovary area. So I was thinking, wow, like I have never felt ovulation cramps quite this intense before. So I said to my husband, this might be twins. Like, it was almost like a knife stabbing me in the left ovary. And it didn't last very long, but it happened at night. And so I went to bed and thought nothing of it, but wrote it all down because I knew my husband wouldn't believe me when I said, this is probably twins. And then if I was right, I knew he would probably try and call me out on it and be like, you're crazy. So I wrote it down on a little sticky note, August 9th, ovulation, left ovary, twins. And so anyway, a few weeks passes by, and August 22nd, I'm over at my friend Emily's house, and she's like, so are you guys gonna start trying it? I'm like, well, like we just started trying this month, so like I'm supposed to get my period soon. She's like, I think I have an extra pregnancy test if you want it. So I was like, okay, like why not? Let's take it right now. Sure enough, positive pregnancy test. I hadn't even come to I think I had a few more days until my period was due. So this is like 4 weeks pregnant, or 13 days past ovulation at this point. So positive pregnancy test, I'm freaking out. I'm excited, obviously. I worked till 8 that night, and I wanted to tell my husband Corey in person. So wrapped up a little gift and then wrapped the pregnancy test at the bottom, and anyway, I surprised him that way, so he was excited, and then shortly after we started telling our family, and then at about the 7-week mark, I started to get very sick. Well, actually, week 5 I started to get sick, so not even a week after I found out I was pregnant, I'm like vomiting already, nausea all day. And I'm barely eating anything besides crackers and water. So I was like, wow, this is pretty early for me to be feeling sick. I was sick with my first pregnancy, but oh my gosh, it was double the amount of nausea and vomiting, and it was very early. Like I was only sick with our daughter's pregnancy at about week 8. So I was like, wow, this could really be twins, either that or my body's just really not liking these pregnancy hormones this time around. So sure enough, week 7, off we go to the hospital because it had been a full 24 hours and that not even water would stay down. So they did some blood work. They put me on an IV to try and rehydrate me. And then they made sure that I was able to keep fluid in my system for at least a half an hour or an hour after the IV. Well, then they discharged me from the hospital, and I threw up the whole way to the car. But at that point I was like, we just spent how much time in Emerge, how much time on this IV. I felt great on the IV, but I'm not going back in there because I can't just stay on an IV all day, every day. So off we go, back home we go. And then I made an appointment with my midwife and said, you know, I think this might be twins, Jess. Like, I think I need to go for an ultrasound, even though I knew my dates bang on. So she's like, okay, well, it's too early to tell for me, so yeah, let's send you for an ultrasound and just rule it out. So I get there, and that was on October 3rd, so the 10-week mark, and sure enough, I tell the lady I'm here because I think it's twins. She gives me this look like she thinks I'm crazy, lays me down, and 30 seconds into the ultrasound, she's like, oh, you're right, it is twins. And so, of course, my mind started racing. I was very excited, but I didn't want to get too excited yet because I know that twin pregnancies can be a little bit more high risk, and then of course I'm nervous because of all the work involved with 2 babies. So it was a very exciting yet nerve-wracking moment. And of course my husband's in the waiting room, so he doesn't even know yet. So I have to go through this whole half an hour ultrasound, and I'm not allowed to ask for any questions until the end. So just sit there in silence and ponder life for a minute. So that was kind of funny. And then twins run in my family, so I kind of had a funny feeling for that reason as well. But yeah, so he comes in the room, and she has the picture of the 2 babies on the screen, and he just said a couple swear words, went white as a ghost, started profusely sweating. And although I had prepared him that this could be the result, he was quite shocked still. So anyway, we announced to our family the next day, and told our friends Emily and Jimmy right away because they also have twins, and so they had sort of been there from the beginning, and we thought it would be twins, but we weren't sure. So anyway, we were talking with them a lot, and so then we decided that we had to go, well, we knew we had to go with an OB, so we had an OB, and we are able to still keep our midwives at this point because we started out with them. So they gave me that option to keep working with them, especially for the post-op care, like post-baby care with twins. They're gonna come to the house and check on me and the babies a lot in the first 6 weeks that they're born. So anyway, a lot more appointments with twin pregnancy. I was seeing my OB at least once a month, as well as my midwife in the beginning. Just in the new year, January, started becoming every 2 weeks that I see my OB, and I alternate with my midwives as well still. So they calculated my due date to be April 29th, and then the ultrasound is also showing that it could be May 1st, but obviously with twins I'm going to deliver early. So as of right now, baby A is head down, which is excellent. Baby B is breech, so head up, but that's still okay. You can still have a vaginal birth if baby A is head down, because essentially what will happen is baby A will pave the way, and then they'll just go in and grab baby B. So I'll have an epidural. As long as baby A doesn't switch, it'll be a vaginal birth as long as there's no complications. I'll still have the epidural just in case they do need to do an emergency C-section. I'll be delivering in a surgical room versus like the regular delivery rooms, just in case as well. The OB will be there, the midwife will be there, and then of course my husband. And I guess a team of people will also probably be in the room, a nurse for each baby, a nurse for me. So, so it'll probably be pretty chaotic day of, but as of January 30th, I will no longer be working. I'm a dental hygienist, and the OB, because I had our daughter 3 weeks early, he's concerned about preterm labor as well as because it's twins. So he wants me to start taking it easy. I haven't gained any weight since my last appointment with him. So I'm at week 26 now. I started pre-pregnancy weight was 120. I'm still only hovering at 140, 141. So he wants me to eat more protein and start taking it easy a little bit more so that the babies can gain good weight. The first trimester was rough. Like I said, nausea, vomiting, tired all the time, sore breasts, and then week 17 hit, maybe even earlier, maybe week 13 hit, and I was already starting to feel a little better. And then a little bit more symptoms at week 24. I was sick, I had a sinus infection and a really bad cold, and then my daughter and I just kept passing this thing back and forth to each other. So I'd get a lot of bloody noses, which is common with sinus infections and also sometimes with pregnancy. And then the other thing I started getting more of now is the belly pain, just because everything's stretching a little bit more. Sorry about that. My memory card cut me off. I think I ran out of space. So anyway, I don't remember where I left off, but just to close the video off here, we are getting ready for the babies to come slowly but surely. This past week we got the nursery painted, the cribs have been ordered, the mattresses have been ordered. We have most of the essentials ready to go. We don't know the genders of the babies, so everything is going to be very gender neutral. That is just our personal preference. We did not find out the gender of our daughter when we had her, and we loved the moment of surprise. So we're going to try and wait it out till the end and not find out the gender of these two babies. We do know that they're likely fraternal because they're in their own placentas and chorionic sacs. So until they're born, the doctor says there's still a small percentage chance that they could be identical, but unless they're the same gender when they're born, we wouldn't know. And then if we wanted to know for sure if they were identical or not when they are born, we have to do genetic testing. So anyway, as of right now, they think they're fraternal, and so it could be one of each, it could be the same gender, and everything's gender neutral. The last major piece of equipment we need is the car seats, the infant car seats. So I've been kind of keeping my eye out for some sales, and that'll be the last big purchase. Corey and I are going to be setting up the cribs this weekend, hopefully, and then I bought like a decal for the accent wall in the room. So once it's all done, I will probably film a little video in the nursery and show you guys and share that. But otherwise, things are slowly but surely coming together. So we're getting really excited. It'll be nice to have some time off work to rest, but also just to get organized. I'll probably wash some of the gender neutral clothes soon and get those ready, and maybe even some of Isla's pajamas and onesies and stuff, just in case there are girls. So anyway, we are going to be probably filming another video in a few days, and then, so if you guys have any questions or comments or would like to see anything specific in the videos, please comment below and let me know. Subscribe to the channel if you haven't already, and then I'm going to be giving you a small little update on what the belly bump looks like this week as well. So thank you all for watching, and we'll see you in my next video. So this is the 26-week baby bump update, and so babies are growing. Again, I started at about a weight of 120. This week I didn't gain very much. I'm about 140, 141, so about a 21-pound weight gain total. And so far things are still very comfortable. Apart from sleeping, that can be a little bit rough, but otherwise I'm still feeling pretty good. A little bit of stretching here and there. I'm using lots of cream just to make sure that I hopefully don't get too many stretch marks towards the end. So